Oh.
All right, how's it going? My name is John. I'll be your student physical therapist today. So I see on the prescription that you just recently broke your wrist, very recently. So first glance, I can see some acute swelling. So can you just have a seat for me? I'm just gonna take a quick measurement. On a scale of 1 to 10, is there any pain at all, or?
Yeah, probably like a 7.
Quick measurement. Okay, all right, you're at about 8 inches for measurement. So I think a good modality for us to use today would be electrical TENS. So the reason why I think this is a good treatment for you is because we don't want any movement in the area, but we do want to feel some like sensory stimulation. So before I'm actually able to perform this on you, I have to ask you a few questions to see if you're a good candidate. So first, do you have any history of cardiac arrhythmias?
No.
Any history of cancer?
Nope.
Circulatory issues?
No.
Do you have a pacemaker?
Nope.
Are you pregnant?
Nope.
Any history of strokes?
Nope.
Seizures?
Nope.
All right, perfect. I think you'd be a perfect candidate for this.
That's good.
Yep, looks good. Okay, before we get started, we'll do a quick skin check. Okay, looks good. Okay, so we're gonna get started by putting the pads on your skin right now. Before we get started, would you like to be draped?
Nope.
Okay, so I'm gonna start off by wiping your arm with alcohol pad so the pads can stick better on your skin. Okay, perfect. All right, we're gonna use the smaller pads because it's a smaller area that we're gonna cover. So I'm gonna attach the leads on right now onto the pads. Okay, I'm gonna attach the first pad on your distal radius, right over here. And I'm gonna attach the second pad over proximal, about 1 pad length away. So right over here.
So for this case, we chose to use high volt waveform because of the patient has acute edema, and just got to edit some of the parameters here. So we're using a negative polarity, which will drain we're desired to drain the edema from the cathode distally to the anode proximally. And we have a continuous sweep here, and then we have a frequency of 100 because this is a sensory waveform. We are not looking for any contractions, and treatment time we are going to change to 25 minutes. Okay, and now I'm going to start to increase the amplitude here. So you should feel a strong sensation, comfortable, nothing painful. So I'm going to start to increase it now. Just let me know when you start to feel something.
I'm starting to feel it.
Okay, is it comfortable?
You can increase it.
Okay.
Alright, that's good.
Okay, and now I'm going to start the treatment. So like I said, you should just feel a strong sensation. It should be comfortable, nothing painful. I set the treatment duration for 25 minutes. I'm going to leave you here with a call bell, just in case you need anything, and I'll check up on you in 10 minutes, okay? Go.
Alright, so our treatment time is up. I'm just going to hit stop right here. Okay, now I'm just going to take these off for you. Okay. Alright, so how's it feeling right now?
Feels better.
Alright, so if you were giving me a scale of like 1 to 10, what would you give me? 4. Alright, okay, so not bad. Alright, so what I'm also going to do is I'm just going to retake the girth measurement just to check for if the swelling had decreased or not. Alright, 7, look at that, lovely. So everything looks good now, so what we're going to do is we're going to continue on with our treatment plan.
Sounds good.
Alright, so this is the end of the treatment, so I'm just going to check for any abnormal redness on the skin before we proceed with our treatment. Alright, it looks good, and we'll just continue with our treatment process.
Sounds good.